Patient has been provided with privacy by closing the door, and my hands have been washed before the exam is performed. Hi, my name's Julie. I'm going to be doing your head-to-toe assessment today. Can you give me your name and date of birth?
Ashley Cisco, 6/24/87.
Okay. Can you tell me where you're at?
Carroll Medical Center
Okay. Can you tell me why you're here?
for a health assessment.
Okay. Can you tell me what month it is?
August.
Okay. I am going to let you step up on the scale. I'm going to get your height and weight, and then we're going to go for vital signs. Okay. Okay. Upon examination of the patient, was shaking her hand, I noticed that her nail beds were clean. Her cap refill was less than 3 seconds. Her skin is warm, pink, and dry. I'm going to start by getting her blood pressure. Her height and weight was, her height was 5'3", and her weight was 140. All right, I'm going to get your blood pressure. Okay, blood pressure is 120/30. Now I am going to get your apical pulse for 1 full minute. Okay, good job. It's about 85 beats a minute. Next I'm going to get your temperature. Okay, temperature is 98.4 and the patient is breathing about 16 times a minute. As range of motion, patient had normal range of motion. She was able to rise from a sitting position on the bed to a standing position without any difficulty. She didn't have to use any type of assisted devices, and she had no involuntary movements. The patient appears kempt. Her dress is appropriate for season. Her mood and her affect are appropriate and comfortable. A patient appears clean. She is alert and oriented *4. Her speech pattern is normal, and her speech articulation is appropriate. I'm going to start by assessing your head. Okay. I'm going to feel the scalp for any type of lesions or lumps. No lesions or lumps noted. The cranium appears normocephalic, and the scalp and hair are clean. I'm going to palpate the patient's maxillary and frontal sinuses. Tell me if you feel pain, pressure.
Pressure.
Okay, that's normal. I'm going to take a look at her ears. Bilaterally, her ears are normal for size, and she has no lesions or drainage noted. Next, what we're going to do is we're going to do what we call a whisper test. The whisper test, I'm going to give you some letters and numbers. You repeat them back to me, okay?
Okay. ABC. 4, 5, 6.
Okay, good job. The next that we're going to do is I'm going to go to your eyes.
Okay.
Your conjunctiva appear moist and pink. Your sclera is white. Your irids are, they're even in color. They appear flat and smooth. Your corneas appear flat. I'm going to test a few of your cranial nerves with your eyes. The first one I'm going to do is called a confrontation test. It's testing cranial nerve 2. Okay, I'm going to show the sheet of paper for me. Cover your right eye. Okay, I'm going to cover my left, and when you see it, I want you to say okay.
Okay.
Okay, good job.
Okay. Okay.
Okay, switch eyes.
Okay. Okay.
Okay, good job.
Okay.
Okay. Next, I'm going to test your extraocular muscles. It's going to be testing your cranial nerve 3, 4, and 6. It's called the 6 cardinal fields of gaze. I want just hold your head still and follow my finger with your eyes. Okay, good job. That test was normal. The next one I'm going to do is I'm going to test you for Perla and for corneal light reflexes. Okay, just look straight ahead. Pupils bilaterally or Perla. Look straight ahead for me. Okay. Patient has a good corneal light reflex. It's bilateral on both eyes. Like I said, Perla is equal, round, reactive to light and accommodation in both eyes. The next thing I'm going to check is your nose. I'm going to check for symmetry, any kind of lesions or drainage. No lesions or drainage noted. Face appears symmetric. Next thing I'm going to assess is the patient's mouth. Okay, what I'm going to get you to do is I'm going to ask you to open your mouth for me, or smile at me first. Okay. Patient's teeth appears white and without dental caries. Open your mouth up for me. Alright, go to the roof of your mouth. Your tongue. Okay. Now I'm going to ask you to stick your tongue out for me. Stick it out. Okay. Alright, say ah. Okay. Patient's buccal mucosa appears moist. And free of lesions. Her tongue was smooth and it had no white plaques or any type of lesions or ulcerations noted. Her hard palate was pink and smooth. Her soft palate was pink and smooth and movable. When I asked her to stick her tongue out, we tested cranial nerve 12, which was intact. I asked her to say ah. Her uvula and her palate rose both at the midline, and her tonsils were 2+, which is a normal finding for this patient. Okay, next I want to go to your neck. Alright, neck appears midline, cervical lymph nodes. There's no swelling or lumps noted bilaterally. Trachea appears midline. There's no lumps or swelling there. I'm going to check carotid pulses on both sides, one at each time. Okay, carotid pulses are present on both sides. Bilaterally, pulses are strong, 2+. Okay, what I'm going to need you to do is raise your shoulders up for me. Okay, good job. Muscle strength in the shoulders bilaterally are normal. There's no atrophy noted. I'm going to go ahead and assess the patient's chest for any tenderness or lumps. Tell me if you feel any tenderness.
No.
Okay, patient denies tenderness. I'm going to percuss and auscultate all lung fields. First, I want to check your symmetry. Okay, all right, take a breath for me. Okay, symmetry noted on rise and fall of chest. All right, I'm going to start by percussing from the right side. Reticence was heard all through the lung fields except for in lung field 4. I could not assess due to breast tissue. Now I'm going to auscultate. If you get lightheaded, let me know. Okay, take a deep breath. Go back. Okay. No adventitious breath sounds were noted. Vestibular, bronchial-vestibular, and bronchial sounds were heard throughout the normal lung fields. Alright, now I'm going to ask you to turn around for me. Alright, I'm going to palpate the back for any types of tenderness or lesions. Do you have any tenderness? No? Okay. Now I'm going to check symmetry of the chest. Okay, good job. Symmetry noted. Now I'm going to percuss and then auscultate just like I did in the front. Okay. Reticence noted throughout all lung fields, which is a normal finding. Now I'm going to auscultate. Okay. Bronchial, vestibular, bronchial, and vestibular breath sounds heard throughout the lung fields. No adventitious breath sounds noted. Alright, now I'm going to ask you to lay back for me. We're going to assess your chest. Alright. First, I'm going to check the chest for any kind of heaves or pulsations, abnormal pulsations. There's neither one noted. Next, I'm going to palpate for the apical pulse. The apical pulse is found in the 4th to 5th intercostal space. In some people, it's closer to the midclavicular line. Okay, palpated the apical pulse. Duration is short, which is normal. Next, I'm going to listen to heart sounds in the apex of your heart, the base of your heart. I'm going to do an apical rhythm and rate, and listen to your heart sounds for S1 and S2. Okay. First is your aortic. It's in your second intercostal space on the right side. S1 and S2 are noted with no murmurs. Second is your pulmonic. S1 and S2 are noted. There's no murmurs. Your pulmonic is found in your left intercostal, or second intercostal space on the left side. Next, I'm going to go for your tricuspid, which is located at your left sternal border. There S1 and S2 are present. There's no murmurs noted. Next, I'm going for your mitral. The mitral is located at your fifth midclavicular line, or fifth intercostal space midclavicular line. S1 and S2 are noted. There's no murmurs. Okay, now I'm going to listen for your apical rate and rhythm. Let's see, rate is about 85 and your rhythm is normal. Okay. Next, I'm going to assess your abdomen. The abdominal contour appears normal. There's no scars. The skin is smooth. It's warm, pink, and dry. There's no lesions. Like I said, there's no abdominal scarring noted. Her belly button appears inverted and midline. There is some scarring noted due to a belly button piercing previously. There is no pulsations noted. Next, I'm going to listen to your bowel sounds. I'm going to start in the right lower quadrant. Okay, now I'm going to move to the right upper quadrant, and then over to the left upper quadrant, and then down to the left lower quadrant. Normal bowel sounds noted in all quadrants. Next, I'm going to palpate the liver, the spleen, the kidneys, and the aorta. The liver is found on the right upper quadrant. In a typical patient, a healthy patient, the liver should not be palpable. Hers is not. I'm going to the left quadrant, the left upper quadrant, where you will find the spleen. In a normal patient, the spleen is not palpable. Hers is not. The kidneys are found in the right and left lower flanks. Typically, those are not palpable. Hers is not. Are you having any tenderness?
No.
Not found, not palpable on this side either. Aorta is midline. It's typically 2.5 to 4 centimeters. Hers is. It's normal. Okay, now I'm going to pull your shirt down. Okay, I'll let you just lay there. I'm going to check. I'm going to assess for legs, for temperature, and for any kind of edema. I'm going to hold pressure over the tibia for 5 seconds. There's no edema noted. Skin is warm, pink, and dry. I'm going to test her posterior tibial pulses bilaterally. Both bilaterally are present, and they're both strong, 2+. Dorsalis pedis pulses bilaterally. It's normal, strong at 2+. Next, I'm going to get you to set up for me. Okay. Now what we're going to do is I'm going to get you to put your hands out and close your eyes. With each index finger, I want you to touch your nose. Okay. Patient's movements were smooth and coordinated. Next, I'm going to get you to touch your finger, one of your index fingers to your nose, and I'll touch my finger as fast as you can. Okay. Do the other hand. All right. Patient's coordination is smooth and accurate. Next, I'm going to get you to take your shin and just go down your heel on both sides. Okay. Patient's lower extremities are, the movement is accurate. Okay. Now what I'm going to do is I'm going to get you to close your eyes, and I'm going to rub a cotton ball over to certain places. I want you to tell me if you can feel it or not. Cross your legs for me.
Sorry. Yes. 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 Yes.
Okay. And this examination is done. 2 health promotions is always practice safe sex and always eat a healthy diet.
Thank you.